going to make a huge difference. It's very much needed because it doesn't exist, and he'll speak on that right now. Thank you, Peter.
Well, thank you, Dr. Mike. Thank you for inviting me. I'm Peter Ács, and that's a Hungarian name, stands for carpenter. And I'm a medical oncologist, and over the years I treated many people, and it always frustrated me how difficult it is to find a proper nutritional supplement for cancer patients. Nutrition is extremely important, across the board, but one would think that especially for cancer patients, because they struggle and grapple with so many different issues at the same time, and I'll talk about that a little later. But even for them, there's no good nutritional supplement that, as a cancer doctor, oncologist, we could recommend. All these supplements have a lot of sugar, 50% or so. The protein is typically soy-based, which is genetically modified and has a lot of hormones and things that's not good for you. And they lack the proper nutritional ingredients, vitamins, electrolytes that one with cancer, especially on chemotherapy, would need. So a year and a half or a couple of years ago, we decided with Hayes, who's here, to found a company based on nutrition, and the company's name is Nutronco, which comes from nutrition and oncology put together. And the goal of Nutronco is to make scientifically designed special nutritional formulations for special patient populations with cancer, for aging also, and for brain health. So today I'll talk about cancer and nutrition a little bit. Next slide, please. Some background about cancer. What is cancer? Cancer is an abnormal growth of cells. These abnormal cells can come from any organ, any cell type. And there's two distinctive features of cancer. One is that its growth is not controlled, and two, that they are aggressive and able to grow into other tissues. Normally there is some turnover of cells in the body, and old cells die, or cells that don't need it, that are not needed. But in cancer, this mechanism is broken. So cancer cells will escape that route that leads to their death, and they become immortal. They start growing. And then when they become aggressive and grow into the surrounding tissue, that's why we call them cancer. Ultimately, they will get smarter, and those cells will learn to travel to distant places in the body and grow there and form tumors. And that's when we talk about stage 4 or metastatic cancer. A little bit of background. In 2015, 1.6 million cases. By now, it's over 2 million a year. New diagnosis. It will grow by 70% in the next 2 decades, the cancer prevalence. We always quoted for patients that 3 out of 10 will have cancer in their lifetime. Now, it's 2 out of 5, which is 4 out of 10. And as Dr. Mike said, within a few years, it's going to be 5 out of 10 or 1 out of 2 every other people. 50 to 80% of cancer patients have nutritional issues. Most cancer patients will eventually require some sort of chemotherapy. This could be either in adjuvant, neoadjuvant, or metastatic setting. What does that mean? Adjuvant treatment, we call it when there is surgery, we remove the cancer, there's no evidence of disease, but there is a chance that it comes back. We do give chemotherapy to prevent it from coming back. This is very typical in breast cancer and colon cancer. Neoadjuvant is when we give chemotherapy before surgery to make it smaller or to be able to remove it better. And metastatic is when there's stage 4 disease and surgery is not possible. The only option is chemotherapy. So most patients eventually will need chemotherapy, other than when it's found in stage 1, very early stage. 40% of patients who die from cancer eventually die of malnutrition. So cancer patients suffer from multiple different issues that all together create this vicious cycle that leads to deterioration of their body. There are several factors that contribute to this. Muscle wasting and worsening weight loss, they all come from malnutrition, debility. There is an increased inflammation, decreased immunity, infections, metabolic changes, fatigue, poor physical condition, and of course chemotherapy side effects. Chemotherapy is something that's very important. It helps a lot of cancer patients, but it does have side effects. It does have what we call collateral damage, because chemotherapy works on cells that grow. Chemotherapy stops the cells from growing, like cancer. Cancer goes fast. So it affects not just cancer cells, but other cells that grow in our body. The hair, the blood, the guts. These are typically the cells that grow. So it's not surprising that the worst side effects of chemotherapy, other than the blood counts being low, are gastrointestinal problems. That can happen from the mouth all the way to the end of the GI system. Mucositis, which is ulceration and inflammation of the inside layer of the GI tract from the mouth ulcers, all the way down. Can cause diarrhea, nausea, vomiting. All these problems will contribute to nutritional deterioration and overall deterioration. Liver damage, muscle wasting. Muscle wasting is something that's very important, and that can come from the cancer itself. Cancer secretes factors frequently that causes wasting of the body, all sorts of tumor necrosis factors, but also just debility or fatigue from treatment. Chemotherapy causes a lot of fatigue. It's like being hit by a Mack truck. Very tired. And if you are sedentary and don't move, you can lose 10% of your body muscle in a week. So muscle wasting is huge, heart toxicity, nerve damage, and of course the decreased blood counts, as we mentioned. An important issue with cancer is the relationship between cancer and sugar. Cancer loves sugar, that is clearly known. And it's so true that we actually use this phenomenon to diagnose and stage cancer. This one is here a PET scan. This is a cat, and this is an overlap of the two images. But if you just concentrate on this, we typically give a radioactive sugar that cancer picks up, and then it lights up on the image. There are a couple of normal organs that pick up sugar, like the heart here and the brain. But everything else that's black here is abnormal. It's cancers. These lymph nodes here in the neck, liver masses, some lymph nodes in the guts. These are all cancer cells or cancer masses. We can do this. We can use this because of how much cancer loves sugar. Now, next please. Sugar does not cause cancer. However, it's very well known that cancer can only use sugar for its metabolism. Back in 1956, Dr. Warburg, I guess, wrote it down first, who was a Nobel laureate, and this phenomenon is still true today. Most cancer cells lack the enzyme to metabolize fat or protein, and they can use sugar. There's also a lot of data that shows that if we use what's called a ketogenic diet, low sugar, high fat, high protein, that is a good treatment or adjuvant treatment to chemotherapy or cancer therapy. There was a couple of recent studies that further corroborate this. From Belgium, the end of last year, this study, which is it's a 9-year study, and where the scientists found a link between a sugar, this fructose 1,6-bisphosphate, that's a sugar that normal cells, cancer cells can convert back and forth easily with glucose or all kinds of sugars, and that compound activates an oncogene that makes cancer more aggressive. In another study, researchers found that cancer cells are able to store glucose that allows energy to be preserved for future use. Because of that, in our supplements, we use xylitol. Xylitol is a natural sugar alcohol that actually the body makes it too in a small amount. It's sweet as sugar, but it's not fermented, not used by cancer cells. It also reduces the absorption of sugar in the gut. It alleviates side effects of treatment, dry mouth, mucositis. So it has other good effects. It protects the gums, the teeth. It even has effects against bacteria, like pneumococcus. Studies in lung cancer and head and neck cancers, they also showed in vitro that it does have some anti-cancer effects, but this is not even the important that we use it for. There is no data that suggests that xylitol can cause cancer or increase risk of cancer. So this is what we use instead of sugar in our supplement. With that slide, I jumped ahead a little bit. Basically, what we came up with, this idea to make a nutritional supplement for a specific population of patients, like cancer patients on chemotherapy, that's scientifically formulated, based on clinical and scientific data, studies on the ingredients, that will improve nutrition, rebuilds the muscle mass, helps with immunity, helps with inflammation. So basically helps break that vicious cycle that leads to deterioration otherwise. And once we break this cycle, we would be able to treat the cancer with traditional treatment like chemotherapy more effectively. And that's our goal with this supplement called Power Onco. We came up with this nutritional pyramid, where as a regular nutritional pyramid is about what to eat. This one is what to eat it for. And these pyramids we have made for special populations like cancer patients, elderly, brain supplements. And basically, this pyramid is specifically for cancer patients. And this is a summary of the important aspects of the supplementation for this specific population. This is based on a high quality nutrition, but then the other issues that we have to target: inflammation, immunonutrition, to boost immunity, to protect the organs from cancer and from chemotherapy, improve energy and activity, improve appetite, decrease nausea, hopefully some anti-cancer effects, provide the proper vitamins, electrolytes, and probiotics. This is what we base our supplement upon. So for our cancer line, we came up with 4 different types of supplements. Guard Onco is for people who worry about cancer or developing cancer. Power Onco and Power Onco Plus, this is Power Onco, for patients who are actively being treated for cancer. And then Renew Onco is for patients or people who had cancer, they're in remission, there's no evidence of disease, but they want to continue with the supplementation, or they have residual side effects of chemotherapy like pins and needles or other problems, and the supplement helps them with that. So the benefits of this nutritional supplement, it's, as I mentioned, clinically formulated, based on scientific data. It supports weight gain, decreases inflammation, boosts the immune system. It protects the muscle tissue, and it helps build back the muscle. The whey protein that it's based on is a purified whey protein, which is purified with an ion exchange method. It has no lactose, no gluten, no fat, and no casein, which is the protein in milk that is very hard to digest. It's a protein mixture, basically, that is very high in branched-chain amino acids and glutamine, and it's has all 20 essential and non-essential amino acids that the body needs. Cancer patients have problems making even what we call non-essential amino acids. Essential ones humans can't make, so we have to have it supplemented or eaten. Non-essential ones we can make, but cancer patients even cannot make frequently non-essentials. This whey protein has all 20 of the amino acids. So it helps boost the muscle mass, we support and protect liver, heart, nerves, and bones. We did not add any sugar, as I mentioned. It's very, very minimal sugar that comes from the natural cocoa. There is a proprietary probiotic blend that we added. Improves appetite, improves taste, reduces nausea, vomiting, helps with the mucositis, helps with GI side effects, improves digestions, and provides energy. A few ingredients I wanted to talk about specifically. We have nucleotides in this powder. Nucleotides are building blocks of DNA and RNA. They are extremely important, but as of yet underutilized nutritional supplements. They basically just recently are being recognized as very important, and how many different benefits they have. The number one is the immune boosting, and we see across the board all types of immune cells, T cells, natural killers, neutrophils, even the antibody productions which comes from the B cells. It across the board, it helps boosting the immunity in an unprecedented way. It's a component of immunonutrition, nutrition that's specific designed to boost immunity, which has typically 3 components: nucleotides, arginine, and omega-3 fatty acids. We have 2 other 3 in this product. Omega-3 we sell separately because it oxidizes and it has to be put in a capsule. Nucleotides improve wound healing, decrease infections, and what's very important in the case of Power Onco is it helps the guts to regenerate. And when we see a lot of damage from chemotherapy in the guts that normally grow all the time and are very susceptible for the chemotherapy damage, they help replace and repair. This is a picture, 2 pictures that compares histological magnified picture of gut inside, where we see the villi, the little parts of the inside of the guts which helps absorb food. This picture shows a gut from a sample from somebody who was taking regular diet, and this from nucleotide supplementation. We'll see that the villi are much longer, much healthier. The surface of the area of absorption is multiple times more than the control. So this is how powerful nucleotides are. I think this is a really powerful picture. Now, we also have probiotics in our products. Probiotics are extremely helpful in keeping the normal flora, the normal bacterial microbiota of the guts. They strengthen the mucosal barrier between the guts and the blood. They stimulate the immune system, both specifically and non-specifically. They can inhibit tumor growth, and they strengthen homeostasis. Diarrhea is a big problem with chemotherapy cancer patients, and also a overgrowth of an abnormal bacteria that's called C. diff colitis or C. difficile colitis. Probiotics prevent that. So probiotics are an extremely important ingredient in our product. Probiotics works best, next, if we also add prebiotics. Prebiotics are fibers that are basically not being absorbed, but they give a surface for probiotics to grow, and they improve their effects. Basically, prebiotics do the same thing. They increase probiotic effectiveness, improve immunity, they abate inflammation, and they have some anti-cancer effects overall. So again, this is the product Power Onco, which has all kinds of benefits. It's scientific designed for chemotherapy patients, and this is a serving once or twice a day to take while you're getting chemotherapy. The last slide is just summarizes our intention, and what we offer is these branded nutritional supplements for oncology, aging, and brain, as well as for general health, which is our 4th line, that we developed clinically and based on scientific data. Thank you.
Are there any questions for Dr. Edge that anyone has? So everyone understands what the concept of this? So if I gave an exam right now, I would get 100%.
Isn't a cancer a problem that the tumor doesn't carry my DNA? Doesn't have my DNA?
It does. It's just mutated.
Doesn't have my DNA, and that's a problem. So I need to get my DNA in it, or my immune system is not recognizing the
That's
new
a problem.
the growth as the wrong growth. It doesn't kill it.
That's one of the problems and one of the features of cancer that it escapes the immune response. It can hide because it stops making those proteins that the body would recognize as foreign, or it hides them. That's one of the features of cancer. That's why it can go under the radar, basically.
And there, Dr. Warburg, what's his name? Dr. Warburg.
Oh, Warburg, yes.
Yeah, wasn't he the doctor who discovered the correlation between sugar and pH level in your body, and also the under-oxygenation of your body.
Yeah, he
So
shows that.
the cell turns anabolic and doesn't need no oxygen no more.
Exactly, but even, and that's the important thing in the Warburg effect, that even when there is oxygen, cancer will use sugar and ferment pyruvate to lactate as if there were no oxygen. And that's the interesting and important thing about that. I'm not very sure about the pH. That may have been a little bit later than the 50s.
So in other words, if the cancer were in an anaerobic environment, but there was no sugar, there's a better opportunity to fend off the
Yes.
cancer than
Yes.
because of that anaerobic environment without the feeding it with the sugar.
Yeah.
But even if it's anaerobic,
If-
even if it's aerobic,
yes.
it's still going to thrive with sugar.
Yeah, with or without oxygen.
Without
it will use
interesting.
sugar.
Yeah, it doesn't
With or
need any
without
oxygen.
Yeah.
Very
That's-
interesting. I
Yeah,
get
but
it.
even when there's oxygen, it will do it as if there were no oxygen. Yeah, yeah, and it also stores sugar in a special way.
Yeah, I think it stores sugar.
Mhm.
And you have a supplement for, I mean, ultimately, everything's converted in our body into glucose is sugar is energy for us. But you have in your product, there is a supplement for that sugar.
We have protein in this.
What is that?
Xylitol.
Yeah, what is that?
Xylitol is a sugar alcohol that is natural. As I mentioned, the body actually makes some xylitol, and that's sweet. So we use it for flavor, but we also use it for its other good effects on the mucosa, on the inner layer of our guts, because it protects them from ulceration, from inflammation. It also, it has effects on the sugar absorption. It decreases sugar absorption from the guts. So it's a sugar supplementation which happens to be healthier and not used by cancer.
But your body can use it as energy. Your cells.
The body doesn't really use it, no. The body uses this protein as energy. Yeah.
But the theory behind the reason why ketogenic diet is so good is because, as you said, cancer cannot metabolize protein or
Exactly.
fats.
Exactly.
So if you're eating both, good fats and protein, you're in a way starving cancer.
That's the idea. And that has been shown in many studies to be an adjuvant treatment. And adjuvant treatment means that it's together with something else.
Right.
So we would still, need your traditional chemotherapy and other treatments, but it does boost the effect. If you eat, fat, protein, and no sugar, you would boost the effect of chemotherapy. The least is you're not feeding the cancer with fat. With sugar. This is a supplement that basically has all important electrolytes and vitamins that somebody with cancer on or off chemotherapy really should have, especially on chemo, put in one. So I used to tell my patients, take this, 10, 15 different things, the B-type vitamins, the D, the calcium, the zinc, selenium, the vitamin D. And if you put all that together, that's very, very expensive. All those supplements that one should take when they have cancer, and all the nutritional elements that are missing when you're on chemotherapy, or when you have cancer and you can't make, as I mentioned, even some non-essential amino acids, we put them all together in one. At the same time, there's no ingredient in there that would interfere with chemotherapy treatment.
Why is that not addressed in our medical world, the male nutrition? Why isn't that?
Because nutrition is underappreciated and under-taught in medical schools, and that's how it is. It is being addressed right here. Yeah, it's gonna take some time for doctors like me to recognize the importance of proper nutrition. Nutrition is really key. Just to say something else from a different aspect, with proper nutrition, you can prevent 30% of cancers. Just proper nutrition. So this is a known fact. Several studies to show that, large studies. So nutrition is extremely underutilized, underappreciated, and undertaught. Yes.
What's your success rate with treating cancer with chemotherapy?
Around 70%. Nowadays, well, I'm not just saying with chemotherapy. The so-called cure rate, or disease-free survival, 5-year survival for cancer nowadays is put at around 70%. But that's includes surgery, chemotherapy, radiation. So around 70% of patients with cancer survive. And then success rate to treat stage 4 disease and some of the cancers that may not be stage 4 but aggressive and resistant, pancreatic cancer, some type of lung cancers, they are big culprits in that. The success rate is much less. But nowadays, even those patients could be considered chronic patients. It's not like it used to be, because some of those patients, even with pancreatic cancer, can live for 2-3 years.
What do you think about the idea of treating cancer without chemotherapy, with altering your diet and using totally natural items?
There are cases where it works. Alkalinization of the blood and some natural compounds, mushrooms and this and that. Yes, there are cases when it works, but I would use those type of treatments together with traditional treatment for best effectiveness. It's unfortunately relatively rare to cure a bad cancer without chemotherapy, unfortunately. But with this is not intended to treat cancer. This is intended to be a complementary supplement to enable us to give the proper treatment in the proper dose for as long as it's needed, and hopefully prevent us from dropping the chemo, holding the chemo, changing the doses, decreasing the doses, and that translates into better success.
Okay, so if it's not to treat the cancer, so if a person's had cancer, went through all chemo, radiation, and in remission, like you said, so it's based just to be on that product to prevent it, or?
The Renew Onco has some ingredients that may contribute to prevention of cancer, and the Guard Onco also. So the one before, for people who worry about cancer, and the one after, they do have some ingredients that this one doesn't.
Oh.
The reason this doesn't, because they may interfere with some treatments.
Right, it's for chemo.
Yeah, the green tea, the curcumin, and those kind of things that do have pretty strong data that they do have cancer preventive properties. So yes, those other supplements, they do have some of those preventive ingredients.
And what's the success rate on that, do you know? No.
I wish it would take a huge study that takes
Right.
a long time,
Right.
thousands of people, and decades of data.
Are there reports or people going on the product what can really tell former cancer patients who went through chemo and all that they really feel different, that their system works better, the fatigue is gone, that other people really out there already who can tell the difference when they took
Not
that
yet.
supplement?
This product came out last week.
Oh.
Literally.
You're kidding.
Yes.
Okay.
No, we are a brand new company that
Oh.
we just launched this product, but we are actually already planning and doing trials to prove that. The ingredients that's in there are proven and shown to do certain things, protect the liver from chemotherapy, protect the heart from chemotherapy, protect the nerves. There's scientific data on the ingredients separately. The combination, this hasn't been tested like that.
Okay.
But we are
Okay.
exactly what you're saying, how you're feeling, is your nausea better, how's your energy, absolutely. We're working
Let
on
me
that.
try it for a week or for 3 months.
You'll feel better.
And call you.
You'll feel better. People actually can take it who don't have cancer because it has a healthy protein
Oh, of course,
with
sure.
vitamins and all just good stuff. He's taking it, and he has no ailments. So it definitely can be taken for, but we actually will have product similar idea with all different benefits put together in one for people who have no cancer, either healthy or have issues but not malignancy, but diabetes, other things, chronic diseases. So we will have those products too. One of them actually pretty soon. That's going to be called Power Health.
The sad part is that in the waiting room for the radiation therapy, you still see candy waiting for the patients to eat.
Absolutely.
Yeah.
This is
And in the cancer clinics too.
Yeah.
cancer clinics too.
They say it's voodoo. That's
Well,
what they say.
it's not voodoo. I mean,
That's good.
we have to
The
the
sugar.
sugar thing. We have to differentiate between causation. It's really not known, and we really know that sugar doesn't cause cancer. It may indirectly, because it will increase your risk, because it will make you fatter, and will increase your risk of cancers just because you're overweight. It will also increase your insulin level. Insulin is a growth factor that can stimulate cells, maybe in ways that it will eventually. That's an indirect effect. But once somebody has cancer, then sugar has to be watched. And now we have data that yes, it actually makes it more aggressive. We know that. And some oncologists will deny that.
Yeah.
Yes.
It's unlike.
But they may have to read the data.
There are some scientists say that if you live long enough and if you have new cells growing all the time, and your immune system is controlling the new cell, make sure the cell has your DNA and not cancer growth, that out of pure accident, your immune system can overlook one growth and it just grows because your immune system forgot to take care of it. it can happen also that because of that you can have cancer.
It does happen all the time. Everybody
Okay.
here will have cancer cells in their body right now,
Really?
but including me, him, everybody.
Yeah.
But those cancer cells are taken care of by the immunity. If you have a good immunity, a good immune system, supported with a good nutrition and the proper things, it will get rid of them. Since somebody's born, there's always bad cells being formed in the body, continuously. At one point, some escapes that recognition, or rather, the immunity decreases to the level that they don't have the ability to recognize the cancerous cell and remove them. Those natural killer cells, they kill cancer cells every day in everybody.
And you
Called
said,
Immunocal.
yeah, that's what I was
Yes.
thinking.
It's
So,
called Immunocal. You're stimulating your killer cells.
yeah, yeah. So, and you said that the last one for the ones that had it already, when, what'd you call it? I don't
A
know.
renew uncle? Yeah.
Renew uncle. Is that available?
Not yet.
Oh,
Not yet. But yeah, this is our first product for this line that's available. Renew Uncle will come down the road.
You know, and as Dr. Hatch mentioned, for example, I'm actually taking Power Onco. I mean, it you know, if you look at the ingredients, I mean, everybody could literally benefit from it. It's a high protein. We're talking multivitamins, the nucleotides, and you know, we've met with neurologists, we've met with sports nutrition doctors, etc., and they love it, even for their segment. You know, we had one meeting for extreme athletes. You know, people who do triathlons, who do who really push their bodies every day. This is something that it's replenishing their bodies, and they love this type of formulation. So the point is that, you know, whether you have cancer or not, this can benefit you. Now Dr. Hatch has formulated it specifically for patients going through chemo, but can you still benefit from it? Definitely.
Absolutely.
And I use it more as a health benefit. I use it as a meal replacement. Now, if you're going through chemo or radiation treatment, it's not a meal replacement. You want to use it or utilize it more just as a additional benefit. But for me, you know, it's a snack, and it kind of kills that hunger pain when I'm craving, having some bad cravings. So.
good point.
So that product right there, what is on the market right now or available,
Yes.
is a product for people who going right now through cancer treatment.
Yes, yes. Everybody with or without chemotherapy could be taking it, but this is marketed for people who have cancer and undergoing chemotherapy.
Okay.
But
And-
for anybody.
But
And-
really
and-
anybody could take it.
yeah. It would have benefits also for former
Yes. Oh yeah.
cancer.
Yeah, especially
patients.
if there is lingering side effects, like
Mhm.
tingling numbness, you know, from chemotherapy, or
Okay.
or diarrhea, or you know, problems that sometimes can last for months or years after chemotherapy.
How is it taken? Is it a powder form?
Yeah,
or
this is a powder that there's a scooper in there. You put a scoop in 6 to 8 ounces of water and shake it, and it's like a, you know, chocolatey drink. It's actually pretty good tasting, and just drink it.
So how is it available?
Well, Dr. Mike has it available here locally, so you can just reach out to him, and
Or you know, our website. It's you know, it's available online. It's available from Dr. Mike directly. As that's easier because you know, you don't need to wait for it a couple of days, and price is the same everywhere.
And how much, if you don't mind me
This
asking?
is $99.99. It's 28 servings, which comes down to less than $3.50 per serving, which is very comparable to even leading nutritional supplements that have not more than just 50% sugar water in them.
So isn't there another way, I mean, to fix that? I mean, 6 ounces,
Eight.
that's a little bit too much water.
So 8 ounce.
8 ounce?
You make it a shake.
Isn't that a little bit too much?
It's
Can we-
It's one
can we
one
come
glass
down a
of
little bit?
So
Not
you
really
can,
the
yeah,
same.
you can,
No,
you can put health
No, you
in
can
health
bring
and
it
then do
down.
it twice a day, or
Yeah, you don't have to do it all at once. You know, if
Yeah.
you're if somebody's going through chemotherapy and they're challenged with just taking it, I mean, that's the beauty. You know, instead of eating steak and broccoli, which probably is a lot more difficult, you know, you got 8 ounces of the recommended dosage form is 8 ounces of water, not orange juice or milk,
No,
water.
has to be water.
Especially if you're going through chemo, and then 1 scoop. Now, you know, you have a shaker or something where you can mix it well. It mixes great. You could sip it, you know, have a straw. You don't have to consume it all at once. You could do it over a couple of hours. That's the beauty of this.
Can you put it in a blender like you're making a smoothie?
Yeah.
And you add your fruit and stuff in there, or not?
you can do. But remember, those have sugar. But if you have no active disease, absolutely, you can put it in a smoothie. You can, a lot of people put whey in a smoothie.
Yeah, you're right, yeah.
Yeah, but that's why I recommend water, because you don't want the sugar from your juice or from the milk to contaminate the product, because it's a ketogenic diet.
I see. Okay.
But the Guard and the Renew, the products, they're not going to be sugar free. So the sugar, again, it's not an issue if somebody does not have cancer. It's you need your sugar, your brain, your heart. You saw on the PET scan, it picks up the sugar and it needs it, and the muscles need the sugar, so it's important. But cancer patients, that's different.
Just for I'm curious, what is really the difference between refined sugar, what is sold everywhere and available, and glucose? Glucose is also sugar.
Yes.
And fructose, after all, is also sugar.
Yes.
But isn't that sugar why is that white sugar, what we consume, why is it so bad for us compared to glucose and fructose?
They're all the same.
It's the same.
Yeah.
Ah.
It doesn't
The
really matter.
sucrose is a combination of glucose and fructose together.
Okay.
It's a bisaccharide. Glucose, fructose, the body readily converts them back and forth without a problem. Yeah, it really doesn't matter. High fructose, corn syrup, that's bad for you because it kills the brain. So no Coca-Cola.
No Coca-Cola. Huh? Not even Pepsi.
Wow.
Not even Pepsi.
No Ensure.
No Ensure. Yeah, that's what they told us in
No
the,
Ensure.
when I was
Terrible,
going through the
47%
treatment.
corn syrup.
Yeah, but it
Yeah,
has
they
no
said-
protein. It
No,
has a lot
no,
of
they said
protein.
it's the
Protein,
most
it's
dangerous thing
protein.
now.
Yeah.
That's what they referred me to.
Yeah.
And
Sure.
that's the problem with
That's the
nutrition.
problem. Therein lies the
You have the
problem.
big companies,
That's why he did
and
this.
don't put that on the internet because they'll come after me. But you have the big companies that only look at the bottom line. Obviously, they use the corn syrup, the maltodextrin, 50% sugar. They throw in a few, vitamins, and they say, 9 grams of protein, only 7 grams of sugar. But there's 42 grams of maltodextrin, which is sugar. It's just needs to break down in the guts, and then they sell it for $3 a pop.
But that's why it comes back. And that's why, even while I was there was like people that came back 4 or 5 times for the treatment.
Yeah, of course.
Yeah.
And the nutritionist who's advising the patient what to, they say, get Ensure.
Yeah.
Because it's a good way
Ensure Plus.
to
you
get
know?
some protein but it's a bad protein really because it's soy based. But there's nothing they can recommend. That's the problem.
Oh,
We're
okay.
giving them an option
Yeah.
to recommend.
There's
Well, I
really
hope
nothing
you
in the market.
get that spread around.
That's
Go
what
to
we hear.
University of Florida. They need you.
Well, we are from Gainesville, so
Oh.
they are down the
yay.
road.
Yeah, they're down the
So,
road.
and we are talking to them. Yes.
Oh, that's good.
In fact, our geriatric, the age advisor, is the director of geriatric research at the
Oh,
University. of
really?
Florida. Yeah.
I love
Yeah.
it.
We work
I'm
hand in hand
very helpful.
with them, and we are going to talk to their, oncology nutrition department and all that. Hopefully, we can do some studies together.
So tell your friends and family and whoever you run into that has cancer or has been through cancer, they have now this
Yeah.
in existence. Word of mouth, right?
Absolutely.
Well, thank you all for coming. We appreciate your
Thank
time.
you.
And hope you enjoy the rest of the beautiful weather today.
Well, it was very